Well, breaking this afternoon, an explosive hearing on the fate of the financially troubled Crozer Health system in Delaware County. The current plans to keep the health care provider going and the hospitals open are falling apart in court. CBS Philadelphia's Joe Holden is in Upland with the very latest as he's been covering the story from the beginning. Good afternoon, Joe.
Siafa, good afternoon. So the deal to save the Crozer Health system is now on the brink of collapse. According to attorneys for Prospect Health, the owners of Crozer-Chester Medical Center, Taylor Hospital, and other health campuses across Delaware County said that if they do not receive an additional infusion of cash, $9 million more, by 4 p.m. tomorrow afternoon, they will begin what is called closure proceedings. They will file a closure motion with the bankruptcy court, setting up a structured timeline on winding down operations. So at this point, if that money does not come through, a Prospect attorney told the judge the hospitals would go on diversion starting Thursday morning and patients would be transferred to other hospitals. The entire shutdown, he said, would take 2 weeks. The judge was clearly shocked at the lack of a deal. An attorney for the state attorney general's office told the court part of the problem is getting the groups that would make up a new nonprofit consortium to run these hospitals going forward is having them see past losses and mismanagement before Prospect filed for bankruptcy. The judge said these hospital closures would mean disaster for the communities they serve. Prospect's attorney said the hospitals remaining open have been a massive money loser and that everyone believed a solution would have been reached, but he pointed to enormous complexities. So if you are keeping track, since bankruptcy in January was filed, a total of $40 million has been sent to the Crozer system to keep payroll flowing and the lights on. More than 3,000 people work in the system and hundreds of people are served by these hospitals. Now, the judge came close to begging parties to solve this. She has set up a hearing virtually tomorrow for 9 o'clock. That is a meeting of the minds in all of this. And then there is a hearing on Thursday. Now, she asked people to forget about the sins of the past as it relates to these hospitals for now. She cautioned those sins will be dealt with at the appropriate time in the bankruptcy proceeding. So to recap, another $9 million due to Prospect Medical and the receiver that runs these hospitals by 4 p.m. tomorrow. Back to you.
What an unmitigated mess. Joe, I have a couple questions for you. If they are able to secure more funds, how long does that buy them? And most importantly, what happens next?
Siafa, so it gives them 2 more weeks. It essentially is all about payroll and funding. It sounds like, according to this hearing, they have the framework of a deal. But again, the cautionary tale here is believing who is behind the operation. The judge said, remember, this is not Prospect Medical from 2020, 2016, 2022. There is a receiver in here now running things, and this is really the hope to take this entire system and move it going forward. And here's an interesting figure. The receiver has identified $140 million of annual losses that this system has been operating. They've identified a path forward that would reduce that to between 10 and 15 million, a huge reduction. The judge is hoping that this nonprofit consortium and the anonymous parties that make it up hear that and know that there is some viability in keeping these hospitals going. Back to you.
That has to be the hope, Joe. Thank you so very much, as always.